An introduction for today's speaker. Mercedes is a women's health physiotherapist and the founder of Vida Health and Wellness in Calgary, Alberta. She received a bachelor's of kinesiology from the University of Calgary in 2008, a master's of physical therapy from the University of Western Ontario in 2010, a postgraduate certificate in pain management from the University of Alberta in 2014, and a master of health management from McMaster University in 2018. Mercedes has unique experience in physiotherapy for breastfeeding support and is an international board-certified lactation consultant. She is passionate about bringing a physiotherapy approach to the lactation world and bringing lactation into physiotherapy practice. Mercedes conducts research on breastfeeding and lactation-related conditions, and she teaches courses on infant feeding for health professionals across North America. Now I'm going to turn it over to our speaker today, Mercedes.
Thank you, Allison. So I'm just going to start out by talking to you all a little bit about infant feeding and physiotherapy and how we can merge the two worlds together. So first, I'm going to talk about some definitions and terminology, which I think is important anytime that we enter into a new area in our profession. I'll address some scope of practice questions that are some of the most common things that I get asked, and really what our role is with this population. And then anytime we talk about breastfeeding, we're talking about two people working together. So we'll look at conditions that arise from the breast side of things and conditions that arise from the infant side of things. And lastly, I'm going to give you some information on continuing education and some resources that you can look into if you have more interest in this area. And then we'll get into the questions. So just a little bit of terminology to start off. Breastfeeding itself is feeding a child with one's own milk from a breast. And so there are two components with that, both what is being ingested and where it's taking place. Chest feeding is a common term in the trans community for those who identify as male and don't consider themselves to have breasts, but are still able to lactate. So just ask your patients what they prefer you call it, and then chest feeding is the exact same as breastfeeding. Pumping is removing milk from a breast with any kind of manual or electric suction device. And then supplementing can take place in many forms. So you can provide either milk or formula anywhere other than directly from the nipple itself. So examples are the bottle, which should be commonly seen. You can cup feed a baby. You can use a supplemental nursing system, which uses a tube. You can feed a baby from a spoon. You can use the tube at your finger, or you can even use a syringe. So as physiotherapists, we can get pretty creative in terms of how to remove the milk from the breast and how to deliver it to the baby. So here we see an example of a manual breast pump and a supplemental nursing system. Here we have finger feeding and cup feeding into little babies. And here's a close-up of cup feeding, which can be done as young as a brand new neonate. So the physiotherapist role, Melinda Cooper offered a course on the lactating breast here in Canada a couple of years ago, and I thought that she put it really well. So I'm just going to read this out loud because I think it perfectly summarizes our role in breastfeeding and infant feeding. She says that those who care for women during pregnancy and childbirth have a crucial role to play in enabling a woman to breastfeed successfully. Now that sound research-based information is readily available to them, professional ignorance, which may have been acceptable in the past, is no longer tolerable. If the potential for helping women to breastfeed their babies is to be realized, professionals must reject much of the received wisdom in this field and pass on to women only those practices which have been demonstrated to be effective. And what she's getting at there is that a lot of our breastfeeding information and our breastfeeding practices really have come down through an oral history. And That works well if we're talking to somebody as a friend, as an aunt, as a sister. But when we're working as a physiotherapist, it's really up to us to understand the evidence and make sure that we deliver evidence based, patient centered care to these patients, just like we would to anybody else. Now, Melinda only works with the adult population. She doesn't really work with the babies, but the same would apply not only to women's health, but also to pediatrics. Feeding, whether it's at the breast, at the bottle, or anywhere else, is the main functional activity for a neonate. And so, if we're going to help these babies with their motor function, I think that it's important that we understand the mechanics of feeding at breast and bottle and some of these other devices, and that we help to optimize that function. Specific to the breast, one of the things that, of course, physiotherapists can help with is inflammation, which can happen in the lactating breast. And so, if we look at the cardinal signs of inflammation, which we should all be familiar with, we have redness, heat, pain, swelling, and loss of function. And really, the restoration of optimal function is what physiotherapists do. And so, if function is impaired by inflammation of the tissue, we can address it. And we already do this in other conditions. We do it in ankle sprains, we do it for inflammatory arthritis, we do it for complex regional pain syndrome, and a variety of other conditions that involve inflammation. So we're well equipped to manage inflammation in the rest of the body. Another way that we can contribute into helping with breastfeeding is with skin integrity. So some of you may be familiar with some of the nipple skin damage that can happen during breastfeeding. And physiotherapists in general are trained to maintain and repair skin integrity. If you think about it again, outside of the breastfeeding context, we're already doing this as a profession. So we understand the effect of excessive pressure and those compressive forces repeatedly on the same tissues when it pertains to things like bed sores or fitting sports equipment like helmets and shoes. Even in wheelchair design and our population with diabetes, we help them to optimize their skin integrity. And then lastly, of course, physiotherapists should be very familiar with pain. In the profession, I know that there is an argument made by some for physios to be pain specialists and for that to really be what we focus on. And I think what we bring to the table is a recognition that there's a whole human being in front of us, and we can take a biopsychosocial approach. And if that's a new term, if that's a new term for you, or if you're not fully familiar with the biopsychosocial approach, I really encourage you to look into it because it really addresses all of the aspects of the pain experience. And we already do this for people with, for example, from a pelvic health background, bladder pain syndrome and prostatitis, from a rheumatology and MSK background, people with lupus, TMJ disorder, migraines. Physiotherapists are already really playing a role in pain assessment and management. And I think that that's something that we can contribute because breastfeeding sometimes is painful. And lastly, I just want to challenge our profession to recognize that the breasts are part of the woman. I think we're doing people a disservice if we say that we'll treat all of you except this one body part. I think that we really need to look at the body as a whole, and their main function is to produce milk. And so we can ask people about breastfeeding goals, what are their barriers to doing this functional activity, and then address what we can within our own scope of practice, which we're going to get into in a little bit more detail in a bit.